Good afternoon. My name is Bill Lachero. I'm Field Director for the Access Project and co-author of this report. The Access Project is a national research and resource center based in Boston, and we provide policy-specific research on healthcare for local communities to use in reform efforts. In 2007, the Access Project joined with the University of North Dakota Center for Rural Health and our long-standing research partner, Brandeis University, to gather data about the source, type, and characteristics of farm and ranch health insurance, as well as about the financial burden that healthcare expense places on farm and ranch families. Data were collected through a telephone survey of over 2,000 non-corporate family and ranch farms in 7 states: Iowa, Minnesota, Missouri, Montana, Nebraska, North Dakota, and South Dakota. The survey was conducted by the National Agricultural Statistical Service, and the survey was called the 2007 Health Insurance Study of Farm and Ranch Families. The Access Project, in fact, will release a new second brief, How Farmers and Ranchers Get Health Insurance and What They Spend for It, which will be the aggregate study on December 18th. Today we'll be discussing a subset of that data, which is Iowa specific. In Iowa, the sample of family farms that were surveyed represented 13% of the sample. They had an average income of $40,000 to $100,000. There were over 90% insured families. Now, being insured, one would expect to have financial protection for health insurance. However, what we discovered through the survey was that 1 in 8 had medical debt, while 1 in 6 had financial burden that they described as eating up their savings, foregoing loans upon their farm, and other financial effects produced by trying to secure and pay for this insurance. The median cost for health insurance for the Iowan farm family was $6,500. Importantly, insurance can be bought through 3 separate functions. 1, government-sponsored insurance like veterans, or one of the spouses of the farm family go off-farm and secure it through off-farm employment. The other option is that the farm buys it on the individual market. What we discovered was that 37% of ranch and farm families buy it on the individual market. That is a staggering difference from the national average of 8%. So we have an average cost of $6,500 for a premiums, deductibles, and co-pays. However, when those individual family farms, those 37%, when they bought it on the individual market, had an average cost of nearly $11,000. So imagine spending $11,000 for a high deductible, high premium plan, and when you need it, still incur debt. It is like buying a farm facility that doesn't work all the time. So we have some significant policy implications here. We need to make sure that what is produced on farms is adequate to when farm families secure this insurance product, that is in fact allowing them the protection they need to go forward. When you have 1 in 6 who are incurring medical debt, that means that that medical debt gets transferred onto bad credit reports and mars their ability to survive. These are very important findings and really impact what is in fact a small business operation and represents what is happening to many, many individuals. If in fact farm families are, as we say in this report, $40,000 to $100,000, these are not poor people, these are middle-class people. So the cost of insurance is so staggering now, and its failure to protect is going into the middle class. And I'd like to share. I'd like to have a personal story be shared. And so, in what I'll do is transfer it over to Chris Peterson, who is president of the Iowa Farmers Union. Chris.